Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
In your dissection of the larynx today, I thought it might be helpful to look first at this model. Basically, the trachea begins and is lined by an elastic cone, which you see passing downward here in yellow. In the area of the larynx, that cone is flanked by some elements of the larynx which you have already palpated, and above it then, of course, the hyoid bone in this region. The thyroid cartilage is located here. In this particular specimen, it's from an older individual in which it is ossified. Beneath the inferior horn of the thyroid cartilage and deep to it, you will find another cartilage which is like a class ring in shape. It is called the cricoid cartilage, the narrow portion of the ring appearing anteriorly, and posteriorly the wider class emblem. In addition to these elements, skeletal elements of the larynx, you need to consider two cartilages which I have modeled in green, and one can be best seen in this view of the area. Here, looking from above, we can see the edges of this elastic cone which begin in this area, and attaching to it two green cartilages, the arytenoid cartilages. They have one process which passes forward and meets with the yellow area, which is called the vocal process, and lateral to that, you can see one in this position, is a muscular process. Muscles of the region of the larynx are going to attach to the arytenoid cartilages and work through them to modify then the tension on this free edge of an elastic cone. Today's dissection then is going to be merely a matter of looking at muscles which operate in this area. They will be located lateral and beneath the thyroid cartilage or posteriorly in this region. So your dissection will first then expose the posterior aspect. You'll examine those muscles. Then we will put to the side the thyroid cartilage, as I will do now. And when we do it, it will be a matter of removing this one lamina. Now we'll try to detach that. This was merely placed here for support. And now we can see the elastic cone which passes from this free edge downward. And in fact, it's referred to as the conus elasticus. It's a cone extending then in this region from the cricoid up to the free edge. The free edge is in fact the vocal cord, and the modifications of it are accomplished by the muscles we'll be studying today. Now let's consider these landmarks on our specimen. Here we can see that this particular side is still attached to the rest of the specimen. The hyoid bone is located here, thyroid cartilage here, which you've already identified, its superior horn, and in this region would be the anterior arch of the cricoid cartilage and trachea extending inferiorly from there. These are your main anterior landmarks. The cricoid is covered here by a muscle of the larynx going from the cricoid to the thyroid cartilages. All musculature in the larynx area is named by then the 2 points of attachments. This one would then be the cricothyroid muscle. I might also remind you that you should locate the superior and inferior laryngeal nerves and be sure that you know where those are located prior to continuing your dissection of the larynx. Now if we consider the posterior aspect, we find that the specimen in fact is still closed. In this region we have cut it open. This is the pharyngeal constrictor, and if you remember, this is the inferior one. We need to open that up to expose then the internal aspect of the posterior surface of the larynx. A series of landmarks are to be identified at this point, and once those have been identified, the mucosa covering this aspect of the larynx can be removed. For orientation, this then is the laryngeal adductus, or opening into the trachea. it is covered then by the epiglottis, which we can see folding down over it at this point. Now we will reflect that mucosa and show you some of the muscles which lie on this posterior aspect of the larynx. Now the mucosa in this region should be carefully incised and then peeled back to expose these muscles. Obviously this area has been pre-dissected for this particular film, but the mucosa can be removed, and deep to this we can begin to see the extent, for example, of the cricoid cartilage. Its inferior border is here, its superior border is here, so that we see posteriorly that this is a rather extensive cartilaginous structure. Above the cricoid and interconnecting the arytenoid cartilages, the apices of which are shown here, are a series of muscles which interlace this area. They should be carefully dissected and their fiber directions determined. One muscle which is especially key in this region, and you need to follow out its boundaries very well, is the posterior cricoarytenoid muscle. It focuses on the muscular process of the arytenoid cartilage. By locating this posterior attachment, one then can remember and more easily locate that particular process when we expose it laterally. To expose this laterally, we will remove the thyroid cartilage. However, before going to that, you should locate the branches of the superior laryngeal nerve, as you see here, and follow the branches of the inferior laryngeal nerve, which I can show you at this point, and determine their distribution within the musculature and mucosa of the larynx. That determined, now let's look on the outside and consider the reflection of the lamina of the thyroid cartilage. Again, the superior horn here, the oblique line for the attachment of the inferior constrictor of the pharynx, and here then the cricothyroid muscle. Things which need to be reflected: first, you notice that the hyoid is missing in its attachment here. That's because we reflected the larynx in total with 1/2 of the head. Normally that would have been reflected. We'll then reflect the cricothyroid muscle and reflect then the inferior constrictor fibers. With these attachments then of muscular attachments to the thyroid cartilage, we're then able to note a joint which exists between the cricoid cartilage and the inferior horn of the thyroid. One needs to cut that. However, prior to doing so, be sure to locate and preserve a nerve which passes very close to that joint, the recurrent laryngeal nerve, or by the time it passes the joint, it is now referred to then as the inferior laryngeal nerve. The joint is cut, and now we need only to make a cut through the lamina, and you can see the outline of the cut which we made prior to beginning the tape. It's a parasagittal cut. That is, it lies 2 to 3 millimeters to the side of the midline of the larynx, and we'll pass a scalpel along that and reflect then the lamina of the thyroid. We'll remove it, and now we are looking at muscles which lie then lateral to the conus elasticus as it extends up to the laryngeal adductus. Here again, for orientation purposes, we can see the posterior cricoarytenoid muscle attaching to the muscular process. The fibers then that we see here attaching and running from the muscular process forward are located lateral on the larynx and therefore referred to as the lateral cricoarytenoid muscle. So we have a posterior and lateral cricoarytenoid muscle. And again, identify fibers mainly by determining the direction of orientation of them. When we first opened this larynx, we found fibers running between the thyroid and the epiglottic region. Those would be thyroepiglottic fibers, and if those are reflected, one can begin to find fibers which run from the thyroid cartilage toward the arytenoid cartilages, and these are oriented in this plane. These actually are fibers lying immediately lateral then to the vocal folds. Now that you've examined this lateral aspect, we'll approach the larynx internally. We'll do that by placing the scissors into the adductus and passing through the cricoid and extending down into the trachea. This will allow us then to open the larynx and to identify some of the structures which are inside it. The epiglottis here, the true vocal fold passing in this direction, the falx here and ventricle in this region. One can see now this tapering effect of the conus as it approaches the free edge, the true vocal fold, and you can actually see underlying the mucosa very nicely the vocal process of the arytenoid cartilage. The final exercise then, after looking at and identifying surface features of the larynx, will be to remove the mucosa in this region and identify the elastic membranes which make an elastic tube extending down into the trachea from this region.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license. listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.